So we have an abstract being presented in poster form here at ASH on this evening. And the purpose of this abstract was really to evaluate the duration of response among patients after they came off of Cevostamab therapy. So Cevostamab is an FcRH3 directed bispecific T-cell engager. And the trial was a phase 1 study that evaluated this treatment in patients with relapsed refractory myeloma. The treatment was given every 3 weeks for 17 cycles, and it was planned for patients to discontinue therapy at the end of 17 cycles and to be monitored off treatment with the option to get retreated if disease were to recur. So at the time of data cut for this study, around 250 patients were enrolled, and about 199 of those were at effective doses. A number of patients, a little bit over 40, remained on treatment at that time, so were not eligible for evaluation. 18 patients had completed all 17 cycles of therapy, and additionally, some patients came off of treatment while still having a response due to an adverse event, and this was 15 patients. So this subset of patients was part of this abstract. So among the 18 patients that completed 17 cycles, at the median follow-up of around 9.5 months, the majority of patients continued to be in response. Only 4 had progressed. And among the patients who came off for an adverse event, those 15 patients that were still in response, there was a median follow-up of those folks of around 11 months, and also the majority of them were continuing in response. Patients did have the opportunity to be rechallenged with treatment if they had recurrence, and this was 6 patients that were eligible and chose to pursue this, and at the time of data cut, 3 had ongoing disease control. So overall, the data was very encouraging for the idea that patients, even patients with relapsed refractory multiple myeloma, when treated with bispecific therapy such as FcRH5 CD3 bispecific therapy, can stop treatment and have excellent ongoing disease control and a disease-free interval.